Hello, welcome to our video series on an introduction to healthcare information technology. This will be the first video in our series of 8 videos that we'll cover in this course. And we'll start the course with chapter number 1, an introduction to healthcare IT. Some objectives for this chapter: define healthcare information technology, recognize some of the benefits of healthcare IT, describe the CompTIA Healthcare IT Technician Certificate, list major healthcare regulators, summarize the major healthcare regulations, and lastly, describe typical healthcare legal practices. We'll start off this chapter with healthcare IT, challenges and opportunities. Now, when it comes to the adoption of information technology in the field of healthcare, this is noticeably much slower than it is compared to other industries. And that's due to some very big obstacles when it comes to healthcare. Healthcare is a very fragmented system. There are countless different versions of healthcare that you can receive in the United States, whether it be Medicaid or a privately owned healthcare system. So it's not just one system of healthcare. There are countless different versions of healthcare that you can find. And among those different forms of healthcare are many different systems that are used among the providers. Adding on top of this is the fact that healthcare is a very highly regulated industry. And it makes it worse is when there's a shortage of highly trained technology professionals who can do the job and do the job correctly. So all these obstacles just make the adoption of any form of IT in healthcare very slow to implement. So what is healthcare information technology? This is a framework for managing health information, and it should be a mechanism to improve overall patient care. This will enable patient care coordination among various doctors, hospitals, clinics, various healthcare providers in general. So the more information that any professional has about that particular patient should make their care for that patient much more streamlined, much more effective. So healthcare IT is also the application of information technology in the healthcare industry. This would include both hardware and software. And these are both used to manipulate health data and information. Now we'll talk about the benefits of healthcare IT. The cost of healthcare will continue to rise. And for example, in 1960, the overall cost of healthcare in the United States was about 5.2% of the gross domestic product in the country. In 2007, that number was up to 17%. And advances in technology account for about half of the healthcare spending increases. But there are some very big efficiency benefits when it comes to electronic medical records. When you have electronic medical records, you eliminate the need for medical transcription. It also reduces the need to physically retrieve charts. Instead of having a very large binder with hundreds of pieces of paper that account for every test that patient's ever had, you can have it on just one electronic file. It also will reduce any duplicate diagnostic tests. Being able to see right in front of you on a monitor what tests have been ordered, when they were ordered, and results of that test, that eliminates the need for ordering a test because you forgot it was ordered last week because you didn't find that note written on the piece of paper in that patient's chart. And now we'll talk about the CompTIA Healthcare IT Tech Certificate. The CompTIA is a non-profit trade organization, and they serve as an advocate for the IT industry, and they provide education and certification programs. Now, the certificate shows the individual's proficiency in certain areas of healthcare and information technology, and also will prepare the student for jobs in the software and technology support within healthcare. And there are various proficiency areas that are covered by the CompTIA certificate. Some of those include healthcare IT regulations, healthcare organization and operations, basic IT operations, network IT operations, document imaging, basic and advanced healthcare security, and medical business operations. Now we'll move on to regulatory compliance and regulators. And when it comes to regulation, a regulation is something that constrains or controls. And then a regulator is the governmental entity that mandates these regulations. And healthcare is one of the most heavily regulated industries in the country. And the purpose of these regulations is to ensure a minimum standard of care for all patients, and also to provide a broad patient access at a reasonable cost. Now, there are some key regulators that are involved with healthcare, and we'll talk about each of these 4 in more detail here in a few minutes. See, on this table we have the name of the regulator here, their acronym that they're known by, and then their parent agency or department. The first one, Department of Health and Human Services, or HHS. That is a cabinet level position, so the parent entity of that would be the President of the United States. The Office of the National Coordinator of Health Information Technology, or the ONC, that works as a part of the Health and Human Services Division. Centers for Medicaid and Medicare Services, also known as CMS. That's also a department of the Health and Human Services. And the National Institutes of Standards and Technology, or NIST. This falls under the regulation of the Department of Commerce. As you see already, within healthcare in particular, there's a very large number of acronyms. So it's very easy to get lost in these sea of letters. So it's important that you understand what some of the major acronyms represent, such as HHS, NIST, CMS, because these are some acronyms that you'll see over and over again constantly. Alright, the first department we'll talk about is Department of Health and Human Services, or HHS. Their mission is to provide citizens access to high-quality health care, also to help find people jobs and child care, help to keep food safe, help to manage infectious diseases, and to extend the practice of diagnosis and treatment. And this is a very large portion of the overall federal budget. HHS represents 25% of the U.S. federal budget. So they cover a large amount of services, a large amount of money that's involved here. Now within the department of HHS, there are a large number of operating divisions, each with their own specific area that they concentrate on. We have some listed here on these slides. Within HHS, you'll find the following: Administration for Children and Families, or ACF, the Administration on Aging, or AOA, Agency for Healthcare Research and Quality, or AHRQ, Agency for Toxic Substances and Disease Registry, or ATSDR, Center for Disease Control and Prevention, CDC, Centers for Medicare and Medicaid Services, CMS, Food and Drug Administration, FDA, Health Resources and Services Administration, or HRSA, Indian Health Service, or IHS, National Institutes of Health, NIH, Office of the Inspector General, OIG, and Substance Abuse and Mental Health Services Administration, or SAMHSA. So all these are operating divisions that fall under the control of Health and Human Services, and each has their own specific concentration that they focus on. One of the divisions that works within HHS is the Office of the National Coordinator of Health Information Technology, or their ONC. And this group is responsible for coordinating use of advanced healthcare IT practices at the national level. Alright, now we'll talk about Centers for Medicare and Medicaid Services Information Technology, also known as CMS. And this is the group that administers the Medicare program in the United States, and also the federal portion of the Medicaid program. Another program that they oversee is CHIP, C-H-I-P, which is the State Children's Health Insurance Program. And when it comes to Medicare, there are multiple parts of Medicare. You probably have heard of Part A and Part B. For Part A of Medicare, this covers inpatient hospital stay insurance. And for Part B of Medicare, this covers doctor services and outpatient care. And this also will cover prescription drug coverage. When it comes to Medicaid, this is a program for low-income people. This will cover certain medical expenses, so they are able to receive health care even if they cannot afford it. And this is jointly funded by both the federal government and by the individual states. Now there are Medicare and Medicaid incentive programs. These are basically cash incentives to providers for adopting electronic health record technology, or EHR. So in order to help encourage providers of Medicaid and Medicare to move from the paper-based record-keeping style, move into an electronic healthcare record technology, they're basically given money to help with the transition. All right, now we'll talk about the Office of the National Coordinator for Health Information Technology, or the ONC. Some responsibilities that they have: they coordinate the use of advanced healthcare IT practices at the national level. They also will certify EHR systems and providers. And there are 3 aspects of certification within the ONC. This would include standards and certification criteria for EHR, certification programs in general, and also metadata standards. All right, now we'll talk about the NIST, National Institute of Standards and Technology. This is a federally sponsored physical science research laboratory, and this is the group that will set the standards for EHRs under the HITECH Act. When it comes to the role of the NIST within health information technology, there have been 5 goals established for this group. That includes coordinating standards, coordinating infrastructure testing, improve EHR usability, extend healthcare's reach through technology, and also to perform research and development. Now within the NIST, you have the NIST and Healthcare Information Technology Standards Panel, also known as HITSP. And this will provide standards and specifications to ensure system interoperability. So for example, specific data and communication format requirements. So all data being saved in the same manner regardless of the kind of healthcare that they receive. Alright, in this table we have a summary of healthcare IT standards, how they're implemented in the process. You have HITSP, the ONC and the NIST develop and test interoperability standards. Then software developers will implement those standards. The certifying bodies will test that software that was implemented. Then healthcare system users will benefit from improved HIT. Alright, now we'll talk about regulatory compliance and regulations. And the first one we'll talk about is HIPAA. And HIPAA stands for Health Insurance Portability and Accountability Act. It's a very broad federal regulation that was adopted in 1996. And there are multiple goals that were established when it comes to HIPAA, such as improving portability and the continuity of health insurance, to manage waste and fraud and abuse of healthcare delivery, reduce the cost and increase efficiency by standardizing the interchange of electronic data, and probably most important is to protect the privacy of personal health records. And when it comes to HIPAA, the HIPAA privacy rule will regulate healthcare providers, various health plans, and healthcare clearinghouses. And these are collectively known as CEs, or covered entities. So any organization, any group that offers any kind of health care would be impacted by HIPAA. And this rule also will extend to business associates of covered entities. Any organization that a healthcare provider does work with will also be impacted by HIPAA. The same thing would apply to business associate agreements. These are contracts between the covered entities and the business associates, basically to ensure that HIPAA is followed. And the overall goal is to protect that patient's privacy. Some other regulations we'll talk about. First one, PHI, Protected Health Information. This is individually identifiable health information. This is created or received by the covered entity or by the business associate. And this can exist in various forms, such as verbal or paper or electronic. And this is de-identified information. And what that means is it cannot be tracked to an individual. You're not going to find a medical record with a person's full name, their address, their social security number, what they've been tested for, what their medical history is, the medications that they take, laid out there for anyone to find and anyone to use. So this information must lack 18 specific identifiers. So if someone were to find something like that, it's just a mess of information that you cannot make out or trace back to one individual person. Again, with the goal of protecting that person's information. Some other regulations. A data use agreement. This will permit researchers to use PHI under specific conditions. So in order for researchers to do a good bit of their job, they need to be able to research patients' history and patients' overall health. So there must be some agreement established to allow researchers to have access to that kind of information. And the group that is responsible for the enforcement of HIPAA is the OCR, Office for Civil Rights. On this table, we have a listing of the HIPAA privacy rule safeguards and their various requirements. For example, a notice of privacy practices and written acknowledgement. So what that means is the covered entities are required to provide individuals an understandable privacy notice of how their information will be used. Some other examples: accounting of disclosures. The individuals receiving healthcare have a right to a list of the PHI disclosures, who is getting their information, and for what purpose. You can have a request for restrictions. The individual is entitled to ask the covered entity or the healthcare provider to restrict who has access to their information. Now, this is why when you go to a healthcare provider, you may be asked to list the people who are able to receive information about you and your health. So this table is a good list of the safeguards that are used and the requirements that the covered entities must follow in regards to HIPAA. Alright, now we'll talk about the HIPAA security rule. Now, this focuses on electronically transmitted or stored PHI. It's also known as ePHI, so electronic protected health information. This has a narrower focus than the privacy rule in general, and it seeks to ensure covered entities provide certain administrative, physical, and technical safeguards for that data. And here are some examples of administrative, physical, and technical safeguards that the security rule focuses on. For example, in the administrative category, some safeguards include the security management process. So this must define how to prevent and detect and correct any security violations that may come up. Developing a training and awareness plan for this data. Being able to maintain a documentation of policies and procedures that are related to the compliance of the security rule. When it comes to the physical category, the covered entity must address a secure workstation use of data, and how data can be accessed, and where and when and by who. Also, what kind of devices can be used to access this data. When it comes to the technical category, the covered entity must implement audit controls for the ePHI systems. It must provide transmission security, which would include transcription, for example. So as you can see, just by the table and how everything is broken down, a lot more of a narrowed focus when it comes to the security rule of HIPAA as opposed to just the privacy rule of HIPAA. All right, now we'll talk about the HIPAA identifier rule. And this mandates all covered entities that store or transmit ePHI have a National Provider Identifier, or NPI. And this will replace all other identification from Medicare, Medicaid, or other government programs. When it comes to HIPAA Transaction and Code Sets Rule, or TCS, this mandates a consistent electronic interchange of PHI, and in particular the electronic data interchange for healthcare. Any technology that's used is tested and proven from use in other industries. And there are several standards that exist, such as the ANSI X12 standard. So this basically covers how electronic healthcare data will be shared, either electronically, such as through the internet, or even the physical moving of electronic healthcare data, such as information on a CD or magnetic tape or so on. Even though you're not emailing it or transferring it through an internal network, any transfer of information regarding healthcare about a patient is controlled by this. All right, now we'll talk about the HITECH Act. And the acronym HITECH stands for Health Information Technology for Economic and Clinical Health Act. And this act helped to set up the Healthcare IT Standard Committee and the Healthcare IT Policy Committee. And it helps to establish the process to adopt standards and procedures when it comes to healthcare information technology. Now, the HITECH Act is a lot more stringent than HIPAA. This has an increased resources for enforcement. It has increased penalties for any kind of violations. Health providers cannot use patient health information without express permission from the patient. The sale of private health information must be authorized by the patient. Patients may audit their electronic patient records. The Act extends to future unanticipated entities. This mandates an encryption of ePHI, and this requires patients to be notified of any kind of breach at all of their data. Now, the HITECH Act encompasses both covered entities and also business associates that deal with those covered entities. So any kind of group that your healthcare provider deals with would also be impacted by the HITECH Act. Now, if there's a breach of the data, the covered entity is required to report their breach to each individual affected. Any breaches that occur within the business associates are reported to the covered entity first. And if more than 500 patients are affected, the Department of Health and Human Services must be contacted. And when it comes to the enforcement of the HITECH Act, there are 4 levels of enforcement. They get progressively more and more serious. The lowest level of enforcement is when there are unknown violations, despite due diligence. You made a mistake and didn't realize that you just made a mistake. So there's no intention behind it, there's no ill will behind it. Something just happened and you didn't know that you were doing something wrong. So the penalties here could be anywhere from $100 to $25,000 per violation. So the next level is having a cause and not willful neglect. You probably should have known better, but still made an error anyway. So this is where you have penalties that could range from $1,000 to $100,000 per violation. So the next level, level 3, is where you have willful neglect, but it's corrected within 30 days of the knowledge of a violation. So for here you have penalties between $10,000 and $250,000 per violation. So you know you did something wrong, it was found out, and it's fixed within 30 days. And the highest level of enforcement is level 4, where there's a willful neglect that is not corrected. You know you're doing something wrong, but don't care, and you don't do anything to fix it. This is where you have a penalty between $50,000 and $1.5 million per violation. And all 4 of these levels of penalties are given on a calendar year basis. When it comes to the HITECH Act and electronic health records, the majority of funding for HITECH is used for provider incentives to adopt electronic health records. And some entities that will provide assistance, best practices, and grants under the HITECH Act would include workforce investment, healthcare IT extension programs, healthcare IT research centers, and healthcare IT regional extension centers. And when it comes to certifying an electronic health record, this has to be tested by a ONC authorized testing and certification body, or the ATCB. An electronic health record in general, the EHR must be used in a meaningful manner, and must be used for submission of quality data and other measures. And it must be used for exchange of health information that improves healthcare quality. There needs to be a reason why the patient's data has been moved to an electronic format. Now, if a healthcare provider has shown that they are proficient in using the EHRs effectively, they can be given financial incentives and listed as a eligible provider, or EP. And there are also incentives that are available for both the Medicare and Medicaid also. And eligible providers may participate in multiple programs. So a healthcare provider may be an eligible provider for both Medicare and Medicaid and receive more than one kind of financial incentive. But there are certain restrictions that do apply. On this table, we have a schedule listing of the maximum Medicare EHR incentive payments that were available. And the way you read this chart is the first number that's listed is your first payment you could have received once you are eligible. So for example, if you were first approved for these incentives in 2011, your first payment would have been $18,000 for that calendar year. In 2012, would have been $12,000, $8,000, 2013, and so on. If you were first approved in 2013, your first payment would have been $15,000, not 18, but $15,000. If you were first approved in 2014, your first payment would have been only $12,000. So basically what this table is saying is the sooner you qualified for these incentive programs, the more money you were able to earn in incentives. All right, now we'll talk about legal practices. Now there are some legal practices that are outside the scope of a traditional regulatory environment, such as a liability waiver, or EHR service level agreements, or a memoranda of understanding. When it comes to liability waivers, these are used by hospitals and physicians to protect them against any legal liability. And these are legal documents signed by the patient. And these will specify provider responsibility in case of a treatment failure or case of an injury. When it comes to service level agreements, these are frequently used in technology applications. These will define the service a user can expect from the technology provider. And some examples of an SLA or service level agreement can measure the downtime period, monthly uptime percentage, the scheduled downtime, service credit, and so on. So basically how the software will work and what the end user can expect from that service. When it comes to the Memorandum of Understanding, also known as the MOA, a Memorandum of Agreement, is a voluntary agreement between health providers. And these will specify some mutually beneficial arrangement, such as a natural disaster recovery. The agreement would specify the responsibilities of each individual entity. When it comes to this Memorandum of Understanding, there are 4 elements of a legally binding contract: either payment or consideration, no illegal activities, the actions of parties must be described, and all this must be agreed upon without any duress or any threats involved from one group to another. Alright, so the overall summary, chapter number 1, healthcare costs keep increasing. Healthcare industry has been slow to adopt use of information technology. HIT, healthcare information technology, is the use of hardware and software to manage and manipulate health information. Regulation can provide constraints or controls. HIPAA protects privacy and security of a patient's health data. There are multiple parts of HIPAA, including the privacy rule, the security rule, the identifier rule, and then the transaction and code sets rule. The HITECH Act increases protections of HIPAA, and certain legal practices exist outside the regulatory environment of the healthcare industry. Alright, that brings us to the end of chapter number 1 for our video series. We will continue this course with our next video on chapter number 2, Healthcare Organizations and Operations.